right, it's 1 minute past 8 p.m. in Malaysia, so I think we're going to start our webinar session tonight. Thank you very much for joining in. Good evening, good afternoon, and good morning, wherever you are joining in, and good day to you as well. Thank you very much again for dialing in at this time and to join us at this live webinar session. Please allow me to introduce myself. I am Dr. Waikit. I am from the School of Business and Technology. And of course, together with me, I have a few important speakers that we managed to invite today for this very important session. And yeah, I'm very happy to welcome them. And but before I introduce my speaker, please allow me to just give you a little bit about a little background about our webinar. So our webinar, the title Explore Postgraduate Studies in Health Informatics and Analytics at IMU. And of course, I'm sure you probably by now you would realize that health informatics and analytics is a discipline that combines healthcare, information technology, and also AI. So, as one of the fastest growing economic sectors worldwide, now health informatics, or maybe sometimes we also refer to as digital health, in many countries, it's actually creating quite a lot of job opportunities. And this is as fast as any other economic sectors there. But do you really like have you ever wondered if this field is suitable for you, or is it time to move into this field? Or perhaps if you're still on the fence, you're not very sure yet, whether this is the right step to move in. Well, I'm sure this session you'll be able to get some probably some pointers to help you to see whether it would be nice for you to leap into this digital revolution. And of course, today we have people who has gone through the process. They have already gone through the master's program. We also have speakers who are currently still doing the master studies. And of course, most importantly, all of my speakers are actually also in the field currently and moving into this field. So it will be nice to actually hear about what their views on about this topic, right? So again, thank you very much for coming in here. And before we move on, maybe just a very quick housekeeping rules to let all of us understand what we're going to do tonight. So we have actually already muted microphone for all of the attendees here. And if you have any questions or maybe feedback, please use the Q&A panel and we will try to respond to each and every one of it. And of course, this live webinar will be recorded, all right? So without further ado, let me go back. Whoops, let me go back to my main slide here. And it's very important for me to introduce the most important people in this webinar. Of course, they are my speakers. So welcome to all of the 4 speakers here that you can see here. And of course, you can also see them online here as well. I'm going to start by introducing our first speaker, Dr. Chuah Kuan. He is the Program Director for the PGHIA program, and he's from the Department of Digital Health and Health Informatics from the School of Business and Technology at IMU University. Hi, Dr. Chua. Thank you so much for joining in. Next, we also have Dr. Mohan. Dr. Mohan is an alumni for our master's program, our MHIA program, Masters in Health Informatics and Analytics. He's currently a senior medical officer at the National Institute of Health of Ministry of Health. Right. Thank you again. Thank you, Dr. Mohan, for joining us for this session. Next, we have Dr. Hanis Binti Hasri. She is also our alumni. In fact, she's our first batch of our master's program student, and she's currently the Senior Principal Assistant Director, also from the Ministry of Health, Malaysia. Dr. Hanis, again, welcome to the webinar session. Last but not least, we have Dr. Alia Nadira Anuar, who is our current master student. And interestingly, she's from the dental department. She's from the oral and maxillofacial surgery department from Hospital Putrajaya. So thank you, Dr. Alia, for joining us today. Yeah. So again, I want to thank all of my speakers for being here. And without further ado, I would like to maybe start this webinar session by just having I think it's quite a light question, but it's a question that is quite important as well. And a lot of candidates usually come to me and ask me the first question. So I'll probably direct the first question to Dr. Mohan. And Dr. Mohan, I would like to ask you, what is your driving reason of actually joining this master's program in the first place? I know that you're actually quite senior enough in the Ministry of Health, senior enough in NIH. But maybe you can share with us a little bit, like what is the motivation behind that actually drives you into joining this program? That's the first thing. And second thing, I know that you actually got a very prestigious scholarship from the ministry to actually join us. So if you can share a little bit, about this information with our attendee.
All right. Hi, Dr. Yan. Thank
Hi,
you.
thank
Uh,
you.
it's actually quite a difficult question to answer.
Right.
Um, so why did I join Masters in Health Informatics and Analytics, right? I have been in the field for more than 15 years. So my background in clinical ground is actually on radiology mainly, and also emergency medicine. So when I moved into research, so current my domain of work is mainly on research on health field, specifically in digital health. So I started my background back 5 years ago, and I'm actually no, I'm not a tech geek or anything like that, and artificial intelligence was actually booming at that point of time. Actually, it was already almost the peak, so it's just before pandemic as well. So on that ground, I ventured a lot into digital health technology, emerging technology per se. You talk about artificial intelligence, you talk about data, you talk about IoT, and so on and so forth.
Right.
So so being a newbie into that field, I needed to know more information because with my position at that point of even currently, I assist industry players. I assist our field within the Ministry of Health as well, that to how to move on with technology into health perspective. So I needed to gain better insights about on this technology related matter because it's always ever evolving. And probably when I did my master's and now probably although the gap is quite a short duration, but the technology has evolved so much. So understanding that was a crucial component for me so that I can advise research in that perspective. I can advise on how to move agendas in technology base as well. So on that ground is where my intention to join the master's program,
Mm.
and thankfully it was actually a listed program under the ministry to have a scholarship in place. So on that ground is where I applied, and I'm quite grateful to get that opportunity to get that the scholarship as well. So that is just a brief of how I ventured into this field.
Nice. Thank you, Dr. Mohan. You're right. You actually sum it in a very, very nice way. In fact, you made it sound so easy. But I remember when I first met you a few years ago, you were telling me, about your aspiration, that how you wanted to move into digital health. So maybe just to clarify a little bit, are you currently still in the clinical setup, or you are more into the research aspect?
Somehow I'm more affiliated 100% more most of the time in research.
Right.
Things are moving extremely fast, and more potential, more and more opportunities to do research on the field of technology base.
Mm-hmm.
Uh, because we know that that is the way forward to assist or mitigate health related problems as well, and it has demonstrated quite good opportunities for that ground. So my main forte now is actually mainly research. I try to go into clinical at times, but it's quite rare now.
Understand. Maybe just a little bit more. If you roll back just a little bit more, and Dr. Mohan, I think you're also a clinician yourself.
Yeah, I'm still a practicing clinician.
Right.
My experience is mainly in radiology and also emergency medicine. So that's
Okay.
why my passion towards image analysis became more pronounced at that point of time. And the understanding is in more depth of that ground.
Fantastic. Wonderful. Thank you so much, Dr. Mohan, for that point of view. Now I'm going to switch the point of view a little bit to Dr. Hanis. So, Dr. Hanis, I know that yourself, you are very still actively, in clinical. Maybe a little background about yourself. I know if I remember correctly, you came from the emergency department. You were really like clinician, really like full clinician. But when you joined the master's program, then I remember there was something in your mind that you wanted to solve problem. There's this pain point that was with you. I remember those days, when you came in with that strong passion about solving problem, helping the department to run smooth and all. Maybe you can, share with our audience a little bit. What was your driving reason of joining this masters in the first place? So this is the first question. Second question would be like, again, I remember when you joined it, it was our first batch. meaning that it was during the lockdown period. So could you share a little bit with us, like, how was your experience then? I'm sure it was quite a challenge, not only for you, but for a lot of us that, we were cooped up in a small confined area, and we were supposed to do this, do that. Maybe you can share a little experience about that as well.
Okay, thank you, Dr. Yam and IMU for inviting me. So I started my journey in IMU in 2021, and I was the first batch.
Yep.
What makes me started to ever think about venturing into health informatics? I remember I have a lot of DM when I posted in my Facebook that I'm going to study. I'm going to start my journey in masters in health informatics and analytics. Then I got DMs from my friends that asking, what's the future of this? Why are you taking this course? What's the future? What are you going to do? So to be honest, I don't know. I told them I don't know. I just feel that I want to improve myself, and I have pain points that I'm going to share. So in 2021, I think everyone remembers that we are having COVID, right? And I was in the pediatric emergency department in currently known as Hospital Tunku Azizah. So we are very understaffed. We are understaffed and overwhelmed with patients. And even though we are in the pediatric emergency, we have very minimal number of medical officers, and sometimes we have to lock our team members because of the contact with COVID. So like, who's going to run the department? And at the point of time, I don't know how can I arrange the human resources. What I know is like, okay, I have a sheet of paper, just draw boxes. Okay, are you available tomorrow? The day after tomorrow, just asking in WhatsApp and Telegram, right? So before I started doing those administrative work, because I was the most senior in the department, so my head of department given me the responsibility to, okay, you are the most senior one, and I have background of pediatric for about 8 years, so I'm well versed with pediatric patients. So I have to do both clinical and administrative work. So at that time I was thinking, how am I going to do this? Arranging these resources, the ventilators, the PPEs, right? So I asked around, and what they are doing at the point of time was still using manual papers. Yeah. So I was thinking, I cannot be doing this, because I have to see patient, I have to wear scrubs, PPE, right. But I also have to do the administrative work. I have to do a lot of things at one time. I also have to go to a meeting and present some statistic. So at the point of time, I use calculator. I remember I use calculator, 1 + 1, and then you have to make sure the number of hours is the minimum. If not, they did the minimum working hours lah, and those things, right? So I calculate using calculator, and then and then I use Excel just to make a table. That's all. Right. No formula. I don't know anything about those formula thing. I don't know. And then suddenly my specialist, she's a consultant pediatric emergency. Then she saw me that I'm doing the roster, right? And then she asked me, what are you doing? I'm like, I have a headache of calculating hours for all these MOs manually. Okay, and then she told me, do you know that you can use formula inside Excel? And I remember I asked her, formula, what do you mean formula? Then she showed me the the equivalent. Yeah, equivalent. This box, this box, that. Oh, can produce number automatically, and I can just drag everything and auto calculate it. Then I was in awe, oh my goodness, I don't know there's such technology. I'm very ashamed. So I really don't know, I'm because currently everyone looking at me like I'm very tech savvy. I know everything about technology, but actually I come with like, I don't even know Excel can do such thing.
Zero background.
Zero,
totally zero.
And then because I think specialists, they have to do some statistic, right? So I think they are like Dr. Mohan. Maybe you guys are very well versed with this Excel, formula. That I don't know. Then she told me, do you know that you can place a formula, conditional formatting inside Excel? Then I look her again. What do you mean? So then the second formula I learned was count if,
Wow.
like equivalent count if. Then at that time I feel like I have like new perspective in life.
Nice.
I didn't know there is such technology can help my work. So at that point of time, I started to I self-taught myself. I enrolled in online Excel
Mm,
class, basic Excel, intermediate class, and then throughout the way, then only I learned. Oh, then this is how people create website. Okay, so I enrolled in a coding boot camp. So I learned
yep.
JavaScript and the programming language. It's
Right.
it's a boot camp of 10 days.
Mm,
And then after that, I was thinking, oh, I think this is something that I like to do, and not many people is talking about this. So
mm,
it's a new thing. So so I asked around. So how do I go forward from this my new interest in life going forward? Because I'm not going to do this automated Excel for life, right? I'm not
yep.
going
Yep.
to do that. So I was like, okay, if this is like the beginning of the journey, so what's next? So I wanted to learn more and explore more. So
Mm,
that's why I explore, and then I talked to my HOD. Then he said,
mm,
oh, he knows a doctor, and he himself, Dr. Azamani,
mm.
he studied the master in digital like years ago. So he said, okay, you should meet his colleague that maybe he can advise me. So I met him, which is so he then advised me. Then I told him, I have this new thing I found in life. So can you advise me what to do next? Like, is there any certification that I can upgrade myself, my knowledge, like with a proper one, master? So he told me, actually, the thing that you wanted to do is called health informatics. Have you ever heard of it? Then he asked me again, have you ever, are you considering studying abroad? Because health informatics only offered overseas, he told me at
Mm,
that time.
mm,
So I like, oh, okay, I can consider that studying abroad, like where UK, I don't know, but I have a family, right? And then okay lah. Then I come back, and then I told my husband, and then my husband showed me the IMU's advertisement of Master in Health
wow.
Informatics. So my husband said, "Is this the thing that you are talking about?" So I like, "Oh yeah, I think it is." Okay lah, then enroll lah. So at the time I was pregnant. I think that at the time few months pregnant. And then I thought, and I didn't take HLP because oh sorry, at that time I tried to sorry, what that time I haven't pregnant. I haven't pregnant. So I tried to to take the HLP, right, but I didn't make it to take the HLP. And then the next year I got pregnant. So that was in 2022 is the new light come in. Then 2021, I saw the IMU advert, and then I was pregnant, and I thought, okay lah, since I don't get the scholarship, and I think I need to take a leave, right? So I think, okay lah, pregnant plus maternity leave plus breastfeeding leave, master. So I like,
One
okay lah,
nice
we just,
outcome.
yeah, I calculated, okay, give birth this time. Then I go to maternity leave, how many months? Pantang and all, semua. Okay lah, can lah, master. Then, but
Wow.
but that was like, oh my god, why lah? I'm so crazy woman. But I make it,
Yep.
even though I extended a bit because during my journey in IMU, I got offer to join the team in the HQ, HQ.
Mm,
So I think it's worth it lah.
mm. Yep.
Yes,
Nice.
I think
So by
that's
right,
why.
so by right, IMU should also award a master to your baby as well.
Yeah,
But
yeah, yeah.
we don't
She
do that.
she all the breast milk all inside the DNA.
Wow, this is a smart mother.
Yeah.
Thank
That's why
you.
she's very smart.
Nice, nice. Thank you so much, Dr. Hanis, for sharing
Yeah.
that. But I think what I take learned the most from your sharing is actually about you actually started with fear. a lot of fear because you're not sure is this right for you. And I
Yeah, I
think
don't know.
you came in the field with really like a sheet of empty paper, like you are ready. I'm ready to learn everything. Yeah, that
Yeah.
was the
Then
feeling
all the
that
lecturer
actually.
come, give me all the knowledge, come.
Yeah,
Don't know
I mean
anything.
that is fantastic because I remember when I first went in, I was like, oh gosh, I have a bunch of medical doctors who are not that proficient in digital skills, specifically in programming, and it was really an interesting experience to actually even share the knowledge about doing basic programming to a lot of medical officers out there. So I must really say that after so many years I realized that is really something that it can be picked up as long as you have the right kind of guidance. You must have the right kind of learning attitude as well. Sometimes I'll jokingly tell people programming is like a foreign language, but the minute you master it, you will be able to do it at no times. And now with AI, I tell you, it's like
Yeah.
great.
Why not? There's no AI in 2021. My goodness.
It's okay, it's not too late. I mean, you are still in the field and we know how to bring AI into that as well. Thank you so much. I'm going to move to Dr. Alia. So, Dr. Alia, you are actually our current student. So, Dr. Alia is in our semester 2 and it's also our final semester for Dr. Alia. So, you are completing your masters in like another few weeks, 2, 3 weeks time. That's when we have the board of examination to actually endorse all the results for our students. But Dr. Alia, can you share it's the same question as I posted to Dr. Mohan and also Dr. Hanis. The same question here, like what was the driving force or driving motivation behind you coming over to IMU to actually do our master's program? And that was the first question. Second question is that when you first joined our masters, you are not from Klang Valley.
Yeah,
And that
right.
that is like amazing. Like, I have students who are not from Klang Valley who actually travels to Klang Valley almost every weekend for classes. So maybe you can share with us a little bit about that. Maybe first sharing us with about your driving motivation and then talk about your experience of coming.
Okay, thank you for having me today.
Yep.
Answering Dr. Yam's question, actually, I tried to make it a long story short. And actually, I was preparing for my oral and maxillofacial surgery specialty. But then during that preparation, I encountered one YouTuber with the study with me mode that usually all the YouTube, you have a lot of that kind of videos. You
Yep.
can, and then I found out that she actually a data scientist. So from
Oh.
that, when it just like from the study buddy from the YouTube, and then I dig further whether Malaysia actually have any accredited course that I can attend without quitting the MOH job. So that
Mm,
was when I found out about IMU Master in Health Informatics Analytics course.
mm.
And because let's just say that my journey to become the OMFS specialist is way
Not yet.
gone. So I'm focusing on the MHIA. So that's how I really enroll in this. I think one of the drive is what desperations. I'm not sure, but that's like probably because I think that I need to do something about my career progress. So because
Understood.
I see one door closed, you can always have another 1,000 door opens for you. So I chose
Yep.
for this because during my preparation, I was exposed to research. And then during that research, I found out that because I published a paper,
Mm,
and then during that, I found out that I actually not into to be a I mean like statistician. I'm not into it.
mm,
So I was like, what can be done with the data?
mm,
So beside then what I found from the YouTuber, and I was like,
mm,
oh, maybe I can do something with the data.
mm,
So as you say, answering your second question, I'm actually not from Klang Valley. Before this, I work in Hospital Tengku Ampuan Afzal, Kuantan Pahang, which is
mm.
266 km from here. So I was like, I drove every weekend
Wow.
because so I drove every weekend. For the first semester, but the first week I entered the class, right? I tried to figure out what was the transportation, what was the most cost effective and
Effective.
everything. I tried bus, I tried train because IMU, the Bukit Jalil campus has one
Mm,
LRT, right? So it's
correct.
like straight to there. So I started back then when the start class, I started the journey by 6:30. But then it's like when I get the hang of it, I start driving from Kuantan Pahang to KL by Saturday morning. So that's how I I went to all the classes every weekend like that. But then I think the driving point is because I am not a computer science background.
Mm,
So I am a firm believer that when you don't know something, you need to have a teacher that in front of you that you can ask everything. So that's what drive me more. That even though the class will be just on Sunday, I will still drive on Sunday morning and go back to Kuantan by Sunday evening up to that
wow.
because I still am very respected all the teachers there because they try to help me understand a lot, especially Python. And then Dr. Chuah is one of the teachers, and then I'm like very glad for him that is like he like actually very passionate, very like try to teach me very calmly without me and panicking with all the codes and everything. And then
Thank,
because of this course, right? I mean, it actually opened me to so many things that I don't even know it's available. It's like one of it is Sakura Science Program in Japan that we
mm,
have actually the twinning program with Miyazaki in Japan. So I actually have the opportunity to join the course that I don't even know it's like fully sponsored. And I was like, the first question that I asked Dr. Yang when you offered to me was like, am I still can join this? I am like almost 40 or something. Do I still can join? It's free. And then I was like, so then I said, sure, you can. You're still not 40 yet. I said, yeah, I am, but is this real? So it's actually that Miyazaki study trip actually was the highlight of the whole course because I actually exposed to the international culture. I mean, like, see how the Japan themselves like use the digital health informatics to
mm,
like improve. I mean, like back in Miyazaki, they are focusing on the Wagyu cow, right? So it's
mm,
like they able to do that. And it's like,
mm,
oh, I don't know these things actually exist. Because
mm.
I don't know until they go until this step into the data analytic.
Mm.
Actually, you can improve like a lot of other things.
Right. Thank you, Dr. Alia, wow, for sharing that nice that just very enriching experience that you share. So you point out a few things. Number one, of course, of your perseverance of actually driving all the way down. So yeah, thank you so much for doing that. And actually, interestingly, I also realized that in our MHIA that so far we have done this like for 4 years. I think this is the fifth year that we're enrolling our student. Every year we have students like that, like they actually travel from another city into Klang Valley, into the campus, into the Bukit Jalil campus and attend class. And I must say that, wow, this is my highest salute to all of the students because they work Monday to Friday. And then when we have classes on Saturday and Sunday, they actually spend their time, they're leaving their home and just come to study, of course, in front of their friends, their batchmates who happen to be, some of them are from clinical and some of them not from clinical background. That's where they get to learn together. And I enjoy the point that you actually bring up that you brought up about the Python programming skill. Yes, I must say, like just I mentioned previously, I must say that this is not a language that everyone understands. It's not like something that you take on immediately. You require a lot of guidance, and I think I'm very thankful as well. The academic team here at IMU, really spend a lot of time very patiently teaching, guiding as well. So yeah, thank you for highlighting that as well. So yeah, this is something that I think we are still very passionate about in doing to help a lot of our students here. And you mentioned about your Miyazaki trip. Yeah, I must say that this is a very one-off kind of opportunity that we seldom get. But what happened was this year we actually had an opportunity to be invited by the University of Miyazaki to go over for a study trip, and that's where they were very interested with our Health Informatics and Analytics Master's Program student, and together with our Bachelor of Digital Health student as well. That's where we actually explore that opportunity, and we send our students over. That's where Dr. Alia actually had this opportunity to do this mobility program at Japan, fully paid. So that is like, wow, wonderful, wonderful program as well. So thank you for highlighting that as well. Thank you, Dr. Alia. Maybe just one more question before we switch to our next speaker. I'd like to ask you, because you're in dental field, and to my very humble understanding, dental data analytics is not something that is commonly done, especially in Malaysia. Like, maybe you can, share us a little bit about this insight. Like, what is it currently in this field, in this dental data analytics, like from your understanding as well and from your exposure? Are you able to share with us like what is currently going on? What is a trend, or is it like people are looking into that already?
I think yes, people, I mean, even the Ministry of Health, from their from their program in HQ themselves. I think they have like a small group that actually attending to this dental data analytic,
Mm-hmm.
but just a very small people of them, not that many. I think like 11 people, and then they are like focusing on the whole dental data from the whole Malaysia currently. But then
Wow.
the thing is, not every hospital, I mean like oral maxillofacial surgery department in Malaysia that have a digital data. We
Right.
especially back in Kuantan, we are still fully manual.
Mm.
That the thing that I just surprised myself is when I transferred to HPJ. I just transferred to HPJ Putrajaya last 3 weeks. So it's like they are fully computerized, and the
Wow.
gap is that different. It's like, okay, actually back then because I was taught that only the dental data is just about the technical process. It's like treatment notes and patient charts. That's all. It was like after I encountered and enrolled in the MHIA, I actually realized because of the master, we need to present, we need at least to do one research paper, right? So
Right.
it's from that data source that I have, even though it's limited, but I realized it's actually a very powerful resource for understanding the trends. It's like because my paper is like trends in how to manage the trauma in dental.
Mm-hmm.
It's like, so I didn't know we actually can predict the needs, we can support other research that can have both clinical view from public health also. And then it's actually can go more deeper than that. Beside that, but to answer your question, I think they are looking into it, but
Mm.
not full force.
Right.
But they're on the way towards that. I hope so.
Nice, nice. Thank you very much for sharing that insight. In fact, from my again very humble understanding, I know in our neighboring country in Singapore, Singapore has quite a good dental data record, and we have a former student who happened to be a dental officer herself. She was telling me, how things have moved in Singapore and how dental data analytics is coming into it, and how predictive analytics are all going into doing disease and stuff like that. So that's really really amazing. Thank you so much, Dr. Alia, for sharing that insight. So now I'm going to jump back to Dr. Hanis. So, Dr. Hanis, I'd like to check with you since you are now in HQ and you briefly mentioned that you're in HQ. Maybe you can let us know a little bit, like, what is your current role in helping this digital transformation at the public sector?
Okay. So, for a context, and everyone here understand my current role, I'm currently under the Medical Development Division. Okay, so Medical Development Division is under the medical program in the ministry. So medical program, the portfolio is that it covers all the hospital and special institution in the MOH. So the public health sector is under the public health program. So dental also has their own program currently, as well as pharmacy and research. Also, they have their own program.
Hmm.
Okay, so the program is it leads by the Deputy Director General (DDG), which directly reported to our DG.
Mm.
Okay, so hospital and then under the Medical Development Division, we covers, because it is the hospital services, right? So hospital services, they have the clinical and non-clinical components.
Mm.
Okay, so the clinical components covers the, pediatric services, all the head of services lah. Technically, the clinical services, surgical, ONG, pediatric, orthopedics. Okay, they are the head of services. They have their own team, and then the hospital management team, and that is my team. So it is the hospital services and management unit. So when I got offered to the unit, it has a unit called the Hospital Information System and Digitalization. So when I attended IMU, actually I wanted to play around with data because that's how the interest came, right?
Mm.
It's data, and then I can do something about it. Oh, I can make a graph, and then I can make a Lucas Studio, visual dashboard, things
Mm.
like that. So I never venture into, system implementation and stuff like that. So actually, I wanted to join the research part, like Dr. Mohan, okay, because I want to work with data. But then the the empty spot is only at that subunit, right? So my boss, which is current boss, he said, it's okay, you just join first, because the working with data is at the end, it is working with data, it is towards at the end of the data journey. But that team is working on how to implement systems so that people will put in data that Dr. Alia mentioned just now, from the manual system, from manual to digital environment. So I said, okay, I don't know anything. Again, I don't know anything about system implementation and change management. It is actually it requires my knowledge from the program that helps me, have some kind of surface knowledge of each and every part of the digitalization process.
Right.
Like I remember Prof. Patrice used to say, you don't need to understand and know very deep about one topic like Python, very deep about Python. You just need to understand very surface of the topics, and then by whichever interest and project you are working at, then you deep down along the way lah. Okay.
Correct.
So this team we implement and we do change management, and then that's why I advocate why it is important to have a data with integrity. Okay, because like Dr. Mohan and Dr. Alia, they wanted to do some research, but where is the origin of the data?
Right.
How to advocate to our users and our colleagues down there at the forefront? You have to key in the data so that it will come back to you in a good way. Like currently we are talking about DRG, like diagnosis related group, so that we can calculate our health financing model and things like that. So I think that's about a bit of what I'm doing currently. So mainly what we are doing is become the bridge between the clinician and IT.
Right.
Yeah.
Yep. Thank you. And I do realize that this is a very important issue because I'll see myself more like a public person. Like I'm a patient. Whenever I walk into a hospital, we see a lot of things, but we will complain about this, complain about that. But usually, in order to have a very nice system to be implemented, basically everybody must understand the process. And I know that this whole process is not easy. Just to understand the process itself is already a challenge. What more to go in, try to implement the best system so that we can get the best out of it. So it is not a very easy task that you have here. So I will have to say that you have to hang in there because we really need your whole team to help, to move this public sector so that we know we can really move very fast.
I'll just add one more thing that
Sure.
so maybe what you understand is that I'm talking about the clinical records, right? But actually my team currently working on the non-clinical records, which is we are focusing on the resource and management digitalization. Okay, how do we know where is the specialist? How do we do the mapping by real time? So that's why we are working towards, but we also need to do the change management to the specialists, medical officers, all the doctors, that they have to key in their information inside the system. This advocacy, technically it's a marketing.
Understand.
Yeah.
Yeah, but these all systems are needed in order to optimize the whole system. If we wanted to run it right, it has to be optimized and it must be done in the right way. So I'm not saying that in hospital we only look at the clinical part. I mean,
Yeah.
clinical part is a very big part, but we also look at the resources part, which is equally important to optimize the running of our operation of our entire organization.
Yeah, correct.
So
It's the
yeah.
backbone actually.
Correct. Thank you for that. I'm going to quickly move to Dr. Mohan because Dr. Mohan is more research. So this is a guy that we're looking at things that nobody will think about. So there are a lot of things that's actually happening, but the researchers are the one that go through this whole process. Maybe Dr. Mohan, you can share a little bit of your experience, like this the kind of digital health effort that your team is actually doing, or maybe is there anything that you can share with us, a glimpse of it, like maybe can we get some first-hand information about the transformation that we wanted to go into?
Right. No, so transformation is the most heaviest and the most important word, like what you mentioned, Dr. Rakit. And I think the publication of the next RMK is also out, that we are going towards AI nation. And I think Dr. Hanis and Dr. Alia has also mentioned important, crucial fundamentals of data. So we are trying to move forward, and digitalization is the only way to move forward. That we all understand that. And but the thing is, what we do not understand, what most of us do not understand, is the nitty-gritty or the fundamentals of data. So, example, data structure itself. We are not there yet because we have got lots of fragmented and siloed, and we are not alone actually in the world. Most parts of the world are also the same. It's fragmented and siloed systems that we have, and we are learning from it, right? So, and giving a formal method of education or formal method of training in this perspective is very crucial, very important to understand data, because we advocate data, right? So, and when you come to the important grounds of research, so research is actually the most fundamental at this era, that I would say, because without research and innovation, we can't move forward as well. And when you talk about research and innovation, it's not only perspective, the entire healthcare perspective, like when you talk about it, right? So it's the entire life cycle of how the patient moves around. So if you've got patients who are acutely ill, you've got patients who are chronically ill, how do you move forward from that? So when you talk about screening perspective, you talk about diagnostic perspective, you talk about prognostication perspective, or therapeutic rehabilitation, and the entire journey of these patients as well. So data becomes the most important thing when you talk about personalizing healthcare, right? And when you talk about that, so education and knowledge about how data standards are supposed to be there. So a few elements that we have actually in place in, so Ministry of Health is actually quite rich in that perspective, that, we talk about data warehouse, we have got PIK on that ground. They talk about data strategy, data perspective of how data is supposed to be in grounds of SNOMED City or ICD-10 codes and so on and so forth, right? And I think Dr. Hanis is also well placed to highlight that how Ministry of Health is fragmented into different programs, and how each program cut across as well, and we work hand in hand as well on the ground. But the problem now is that technology is not waiting for us. Technology is moving so fast, so far ahead. And I think we all realize that. I think we are lucky or unlucky, I'm not too sure, because it's moving too fast, and I can't cope up with the pace as well. So LLM came out 2 years back in a public matter with ChatGPT, and that from LLM to generative AI, now to generative AI, and it's just moving forward too fast, right? But we can't cope up at this point of time. Reason why is we don't have the resources of data on our national ground as well. And so I perspective in my personal interest is on unstructured data. Probably Dr. Hanis has got a perspective of structured data or semi-structured data. So when I start about unstructured data, probably purely on image. So medical image, it cuts around radiological images, it cuts around dermatological skin images, it cuts around ECG images, whatever you talk about on perspective of medical images. So that is where my passion is all about. And I think it's more interesting in that ground. I think, and Dr. Chuah would agree with me as well, that, when you talk about structured data, it's just numerical values. Okay, LLM is a bit different. But when you talk about unstructured, you talk about image data, you're talking about pixel values, you're talking about how gradient changes in that perspective, how diagnostic or prognostication can be done. It's actually quite marvelous how data can generate insights on that ground. So this is some insights that I get through formal education, like formal training on that ground. So it gives me a better perspective on educating people as well, and educating myself on how to move forward. And with those knowledge, actually, it allowed me to talk about further in technology as well. And I'm quite lucky, probably Dr. Hanis, is not that I had ChatGPT during my time. Although now ChatGPT 5 is there, and it's a better way. So, when you talk about ChatGPT, it's quite marvelous. So I've got these routine processes I travel a lot, I move around, I'm not in the office most of the time. So, and we need to document our movement and all. So I just had a query in ChatGPT. It actually used and we used Google platform. So it allowed me to actually create an entire system within 2 weeks, troubleshooting and all. So I've got now an automated system with ChatGPT. But you still need to know the knowledge and know how the script of JavaScript works as well. So those are the insights that it's quite needed to understand. Because reason why is, if at all ChatGPT gives you the in a different way, probably the sequence of the codes are a bit wrong as well. So you understand that this education that I had actually didn't give me that full insight how to code directly, but understanding code is the most crucial element that I took out from it, right? And also give me an insight that I think it was quite probably now thinking about it and all, it was a good choice that I took one of the elective modules of bioinformatics, although I regretted taking it at that point of time because of that knowing how and understanding of the entire bioinformatics world is, it's too much within a short period of time, but it allowed me to communicate. So my field, my forte at this point of time is communicating within the clinical ground to the technology. So that's where I'm bridge in between both of these teams. And it allows me to run projects because I'm the principal investigator of several projects as well on digital health. Maybe on image analysis, on home remote monitoring perspective, IoTs. I talk about a lot on all those grounds as well. And back to how to move forward in the policy direction is be emphasizing digital health, emerging technology in delivering health, in improvising healthcare as well. And those has been the foreground on the next targeted researchers as well. But we still need to go back to fundamentals, which is data. So data, we need to go back to the field to collect those data, right? And it's not just about data. So when I talk about image data or even text data as well, collecting data is one part of it. Processing them is another part of it. So annotating them, segmenting them, right? Giving a better perspective of quality of data is also there. And it also, you have got lots of open source data, but the genuineness of the source of data is also an important factor that you need to look into grounds. And when you talk about explainable AI is also a different topic that you're going to talk about as well. And those are also all the foregrounds of how policies are being targeted or directed as well. So explainable AI, ethical AI. So those are the important words that we also talk about on a research front line as well on this ground. So actually, if you there's too many things that I can actually talk about and explain, but with limited time and just giving a touch base on all these grounds, I'll probably limit myself on that. Probably allow you to prompt me to ask to answer you more questions.
Nice. So you're like giving me a strategy on how to do a prompt engineering, asking you more question after this. But yeah, you are right. We do have a limited time for our webinar. Unfortunately, we can't have the whole night. If I can have a whole night, I can really, talk about it. But I think you bring up a very important part in your journey that you did mention that having that formal education background is really very helpful for your current role. So just to emphasize on the point, even as an academician myself, I must say that things that we teach every day, it changes so fast. So you are right. Hanis, you're right. When we first started our master program, there was zero AI. We were not even talking about AI. But today, everything must be AI related. In fact, I also have a very similar feeling like Dr. Mohan. I just feel very overwhelmed because technology moves so fast. And it's like before you can catch your breath, you already have to run the next run. So sometimes we also find it difficult to catch up ourselves. But I think being in an academic field, we do have one advantage. That is we also go back to fundamental. And a lot of the work that we do, whether you're at application level or whether you're at technology or even delivering to patient, it all goes back to fundamental. If we lack of fundamental understanding, I think it's very tough. For example, everybody use ChatGPT, but do people really know what is AI? Gen AI, for example. What is the algorithm that runs behind it? If we really understand all of that, it actually help our thinking process as well. So because of that, we intentionally invited Dr. Chuah to actually explain to us a little bit about this program. So I'm going to stop sharing my screen now so that I can allow Dr. Chuah to actually share his screen. And maybe Dr. Chuah, you can bring us through, let us understand how does the Masters in Health Informatics and also Analytics program bridge this gap that, that we have been talking the whole night. So what about the model? How does it like what is the delivery model that we actually have? So Dr. Choi, if you can bring us through, that would be great.
You hear me?
Yes, very well. Thank
Yes.
you.
Thanks. Thanks, Bucket. Okay. So I would like to start my talk, right, with introduction that is a little bit more catchy. Okay. Imagine a future that you can have consultation with doctor, that the doctor can focus on you instead of writing some notes or typing on the computer. Okay. And after you finish talking with the doctor, all your medical notes are done, computerized, and you have the database, you have the medical reports, accurate medical reports. And this is the future that we are actually already having, okay? Because one of our professor is already having this kind of product. And imagine another future that if you see an ambulance, they are saving people, and then at the same time, they still need to fill in the forms, and they are very busy, and they are actually held back by a lot of paperwork. So this is actually what's happening now. And the future facilitated by health informatics is that the ambulance and paramedics will be able to help the patient in a more focused manner. And when they talk to the patient, all the conversations will be captured by a program in the paramedic's phone. And then just before the patient reach the hospital, everything, all the paperwork will be done, and hospital is prepared to treat the patient. So this is also a future that we are already having, right? So is that fast? Is that futuristic? But we already have all those products. But how are we going to have more people aware and able to implement more of this digital technology, more of this health informatics technology? This is the course that you will join and learn and be part of the digitalization and AI integration journey with all of us. Okay, let me introduce you with the program. So postgraduate programs in health informatics and analytics.
Sorry, Dr. Chuah, maybe can share the presentation slide.
Yes, I'm going to share now.
Yep, thank you so much.
Okay, so are you able to see the full screen now?
Yes, we can. Thank you so much.
Okay, so why join MHIA? MHIA is actually a one-year program, one-year programs specifically tailored for working adults, tailored for working adults. So our students come from working physicians, doctors, pharmacists, and also nurses, not just people in medical field, but also people in, for example, HR, for example, nutrition and dietetics. So our students come from all different fields. And by joining this program, it will help with your job growth because digital health informatics is one of the fastest growing economic sector globally. So if you are well informed about the growing technology and you have the skills and ability to implement technology into your daily job scope, then you have the opportunity to grow. Okay, MHIA is a one-year program, and the lessons are in the weekends. So Saturday, Sunday. That means students who are very, very highly motivated and still need their income will be able to join us and still hold on to their jobs. So it is a flexible study option. Okay, students are able to join us either face-to-face and sometimes online classes, and they are primarily in the weekend. Students are able to complete the entire program in 1 year. For students who want further flexibility, you're able to join us as a master student and complete it in 2 years or 3 years even. And students who are not as ambitious or even need further flexibility is able to graduate in a shorter time and take fewer subjects, but exit with a lower certificate, such as postgraduate diploma, which lasts for 9 months, full-time. If it is full-time, it lasts for 9 months. Or if you want a shorter course, you can graduate with a postgraduate certificate. It lasts for 6 months. So These are the regions to join the master program or the postgrad health informatics and analytics program. So it helps with your career advancement, it provides you with career opportunities, and it has got international recognition. Okay, so these are some of the modules that I'm listing here. So I should not be going into details. If you are taking the postgrad certificate only, then you'll be finishing 22 credit hours and earn the postgrad certificate. And if you're taking postgrad diploma, you will be earning 30 credit hours, taking all these modules with 2 elective modules. And if you're taking a master program, at the second semester, you will be doing a research project addressing critical, important clinical issues and using data or AI to address digitalization problem. Okay, so this is a 40 credit hour program. And prospective students might be having doubt about whether I am able to join, whether I'm able to cope. And I would like to highlight that we have modules that are specially tailored for students who do not have statistics and programming background. So we have these 2 modules, statistics thinking for health analytics, and we have introduction to computer science and programming. We build up your mathematics and statistics background from scratch. That means from your basic degree that are not related to statistics and mathematics, not related to Python and programming, and we build up your ability to do that. Okay, some career opportunities. Okay, in healthcare, you'll be able to take on work like data analytics for forensics, digital health transformation manager, health system developer, clinical information governance manager, and then in the Infocom technologies, you'll be able to be an engineer, data model engineer, for example. In data science, you'll be able to join as R&D data engineer or any healthcare researchers. Of course, for students or adult learners who are very adventurous, you can be your own boss, being an entrepreneur, holding a company who is solving important clinical problems. So these are some of the positions that our graduates are currently holding. For example, data analyst, and digital protege, data quality officer, senior healthcare data specialist, business intelligence officer, for example. So here we have a list of projects our students have done in their final semester. So it includes projects in pharmaceutical, projects in medicine. You can have a look.
Yep.
And projects in various other fields around healthcare as well.
Right.
Okay, these are our industry partners, and you will have industry exposure after you join us as student. And here are my contacts. Okay, I should conclude here.
Yep. Thank you so much, Dr. Chua. That is very informative, and we learned so much just from your sharing about program. So yeah, I think interestingly, even as you're presenting, we actually have a few questions that actually already run in the background. So maybe yeah, so thank you for that. So maybe the first question I will go to Dr. Chua first. So one of the question that was posted here is asking about workload. I think workload in terms of workload in the master's program, assuming that one of our attendee is actually a full-time houseman. So, Dr. Chua, maybe we can share a little bit about the format of our assessment for our module.
Okay, I would like to highlight that, right? This program, we do not have pen and paper exam or those invigilated exam.
Right.
Our assessment methods include project, include presentation, reports, group work.
Assessments.
So they are all in-course assessments So it is comparatively less stressful for adult learners. And workload, of course, for building up the foundation in terms of statistics, mathematics, and programming and data analytics, students are expected to spend time in their non-lesson day. So, for example, days that they don't attend lesson, they are expected to spend time doing some self-learning, picking up what lecturer has assigned and what lecturer has taught. Yeah.
Correct. So thank you. Maybe just to add on one point is that yeah, we do have this full-time mode. So Dr. Chua did mention that full-time mode is actually only 1 year, but bear in mind full-time mode meaning that you have to basically come back to the campus every weekend. So imagine if you're working for working from Monday to Friday, and then Saturday and Sunday you have to come back to study. I think that is quite demanding. And in our experience, we do have a number of students who are able to do it, but at the end of the semester, they'll be like, you know, that kind. So it's really, like Dr. Mohan really like that. So he already know. Yeah, so it is quite a challenge, I would have to say. If you are a full-time working, we highly recommend that you change into part-time mode. That also gives you a lot of opportunity and flexibility as well. If you have slightly longer time, maybe not as stressful, I would say. But if you are like, oh, you are so gung-ho, you can do it. Yes, I'm fully highly motivated. Please then join us to do full-time. Then we have this 1 year window, and hopefully we can help each other by looking into your workload and then see how do we do that. But I must say that you need to be mentally prepared for that as well. So we hope we answer to your question. And then after that, maybe another question that is related to Dr. Chua as well, since we are here with Dr. Chua now. So the question from Anne, may I know which module category am I qualified to go with from a diploma in nursing qualification? I work shift full time. So I think maybe and you're trying to understand, like, if you have a diploma in nursing qualification, are you able to join our master's program? I think the short answer to it is no, unfortunately, because to join a master's program, you will need at least an undergraduate. So to join a master, you will need a bachelor degree, unless you already have many years of working experience, when we might be able to look into appel. So related to appel, we can contact you separately. So, and if you can leave down your contact with our team here, our team will be able to contact you to probably help you more in terms of the appel. Or maybe you come to our department, come to our marketing team, and our marketing team can actually provide more support. I hope that answers to you, Anne. Yeah, sorry, Dr. Chua, I should answer on your behalf.
Okay, I would like to highlight that
Sure.
our entry requirement,
Mhm.
we don't specify which bachelor degree, which field you are from. So that
Yep.
means you can come from any field. We even have
Right.
students from Bachelor of Film Production applied to
Right.
us. So yeah, as long as you have a bachelor degree and you pass, right, the bachelor degree, then you may apply.
Yep. Thank you for that. I think that answers to the question from Damia, because Damia asked that if he doesn't have a clinical background, can he still take this course, and what's the percentage of healthcare in this course? So to just strengthen what Dr. Chuan mentioned, yes, if you do not have a clinical background, you are still welcome to join this program, because we do have students who are not from clinical background. And when the clinical plus non-clinical students come together, that's where the magic starts. So I remember I have class with an engineering student. Sorry, he was from engineering background, and he's an entrepreneur. So during a lot of discussion, it was so interesting that we were discussing so many things with him, and we came up with very brilliant idea about something. So the short answer is no, we do not require you to come from a healthcare background. And in terms of percentage of healthcare, it's about 30% in the whole module, because we cannot do health informatics without understanding health systems, for example. So yeah, there are some elements that you are required. There are some modules that you require to actually learn about the health elements. So that is for Damien. I hope we answer to your question. Then Dr. Chua, if I can also, sorry, we're still in this curriculum thing. So this question from somebody who said that how does the syllabus of health informatics compare to data science and biomedical informatics in terms of coverage and depth? And is this program accredited in health informatics? Is there any limitation in job role for graduates with non-medical background? There are three questions there. Maybe we can answer one by one first. So Dr. Chuah, we can probably go with the first question first.
Okay, so the first question is about comparing data science, biomedical informatics, and the depth of coverage, right? Biomedical informatics is a very specific niche within the health analytics field. So biomedical informatics, if you're talking about bioinformatics, then it's about genetics, proteomics, right? It analyzes DNA, analyze protein-protein interactions, and the interaction of biological materials with the different medicines, for example. Data science, we are focusing on analyzing data, no matter it is from biomedical settings or it is from operational settings, or it can even come from engineering settings or even environmental settings if you're talking about just data science. So health informatics is actually an integration of data science and biomedical data, right? Biomedical data not limited to just genomics, proteomics, and drug interactions, but it includes, for example, biomedical images, right? And doctor-patient conversations, and then operational data in the OT, and operational data in the whole hospital, for example. So the syllabus is integrating data science and biomedical informatics. So you will get the chance to implement the skills in data science into biomedical data.
Right.
So is this program accredited in health informatics? This is a definite yes. We just got our re-accreditation this year. So it has been accredited in a few years ago, and then it has been re-accredited. So no worry about accreditation.
Yep.
Okay.
Accreditation by the Malaysia Qualification Agency by MQA. Yep. Thank you. Yep. So is there any
And
limitation in terms of job role? For non-medical background, I think we can probably speak from how our alumni have been doing so far. For those non-medical background alumni, they are currently not they sorry let me go back to the point. They are non-medical when they first started, but after they completed the MHIA, although they didn't stay on into health informatics, but a lot of that actually stay on to health related data. For example, we do have a number of graduates or alumni who actually works in pharmaceutical data. This is something that we didn't talk about even in our talk today. And pharmaceutical data is one of the biggest data. We have people involved in HR data. We have people involved in this what do you call that? I suddenly lost my mind. This insurance data, the tech insurance and all. So we actually have student graduates who actually can pivot into various fields, but in data field. So I hope we answer that. Yeah, thank you. And then maybe just one question that I would like to maybe go to Dr. Hanis, if you can help me to answer this. How have analytics improved patient outcome or maybe hospital efficiency in your experience?
Okay. So the question is about using data to improve patient outcome.
Right.
So first we have to understand where is the data come from so that we can make an analytic to improve patient outcome. At the moment, so this is a real case scenario, okay? So we have this mindset of improving patient care. So whenever people talk about healthcare and analytics, AI, it's all about patients. But actually, the part of improving patient outcome through data is not a usually it's not a direct data analytic. So for example, it's not from, you know, like diagnosis, treatments, because if we use data and AI in the diagnosis and treatment area, it will involve a lot of policy, uh, clinical practice guidelines, and clinicians usually they are quite reluctant to use this technology yet at the moment. So what we are currently doing is that improving patient outcome using data indirectly by by managing data on the resources, bed management, prediction of the bed availability, prediction of where we should place our cardiothoracic surgeon in the next 5 years. Okay, and then what medical assets that we have to purchase so that we can improve patient care. So those are the type of data that we are currently exploring, and some we are working on to analyze and implement on the real ground. Because the idea of using data analytic to improve patient care directly to the patient itself, it will involve implementation and change management on a clinical person. Okay, so that's the I think we have to understand innovation doesn't equal to implementation. So we can innovate things, but it doesn't necessarily could be implemented. It could be like a white elephant in the room.
Right.
Okay, so and then when we talk about data analytic, it will involve a lot of brain resources, like we are here. You know, you need someone to be data literate. You know, someone that is very high skilled in, you know, procuring the data, the data with integrity, and then process the data, and then do the analytic, and then presented the data to the top management so that you can improve the patient care. So it's a journey, of course, and we sure need a lot more people to embark on this area of health informatics, because I can see, like Dr. Mohan mentioned just now, the technology is keep on evolving, but we also need more people to, you know, like I'm the implementer, Dr. Mohan is the researcher. So we need everyone. We need to have like an entire village of health informatician so that we can use data and technology to improve patient care directly and indirectly. So there's a lot of things to be worked on actually.
Yeah, thank you. So I guess there's no one simple answer to this. So there's, in fact, in a change management perspective, it takes years. Sometimes it takes 1, 2 generations just for
Yeah,
change to
correct.
happen. So but we have to start from somewhere. So I must
Yeah,
say that,
correct.
yeah, it will be with the hope that, with a lot of things that we are doing now, it's really for the future, a lot of things that we are doing. But if we do not start now, I'm not sure when are we going to do this. So we need to start somewhere. So yeah, thank you for that, Dr. Hanis. I think that perspective is very important. And maybe just one last question, and I think this would be maybe to more for Dr. Chua, but I think we can probably answer together. I think this participant is trying to ask about imaging. I think it's imaging informatics. Do we have a special one for radiology? Sorry, you have a BSc in radiology and would like to study but more into radiology. Is that available? So maybe the simple answer is we do not have imaging informatics, but a lot of our case study does have medical image as well. And maybe Dr. Chua correct me if I'm wrong. For example, like even Dr. Mohan himself, when you did your final year project, it was on medical image. So they are actually, like, I think in terms of the research perspective, they are quite free in choosing the topic that they are their specialty is. But maybe Dr. Chua, just to help me a little bit on this radiology on imaging.
Yes, the program, the master program itself is not a radiology program, but you are working with us and me who are already experienced in analyzing radiology images, right? So I have experience of working with not just liver images for HCC and also on X-ray images for lung metastases and for the knee images for the wear of the meniscus, for example. So all of these I have experience, and our team of lecturers are also able to bring you up to be doing all this work that are related to image analysis in also in order to implement AI, LLM, not just LLM, but VLM, Vision Language Model. That means in the future, the language model that is capable of doing vision tasks is able to just take in an image and produce a radiology report accurately. Yeah. So it's actually a work that I have read through today. It is not perfect yet, but the state of the art is addressing these problems.
Wow, nice. Thank you so much, Dr. Chua, for putting it that way in a very nice way. I think with that, we can even conclude our webinar today. Well, we're overshot by 17 minutes. Thank you very much for all of you. You know, your questions are amazing. In fact, I want to thank all of the speakers here for such a wonderful sharing. I think I learned so much today as well. And I want to thank each and every one of you. I want to thank Dr. Alia. I want to thank you, Dr. Hanis. Thank you, Dr. Mohan. Thank you, Dr. Chua as well. And also, I want to thank the attendees today. Thank you for staying on for this session. And if you have any more question that you would like to ask us, please contact our staff, and our staff will be able to assist you further. So with that, thank you again for attending for this webinar session, and we wish that you have enjoyed and learned something as well. And we hope to see you in the future. Of course, we really hope to see you in the program as well. But if we see you outside, just to say hi to us as well. So thank you again, and we hope to see you soon. Bye. Thank you. Bye bye.